most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about absolute best TMJ treatment you can do yourself for quick relief. This is an updated video. We did this one before. We're going to do a better job now, and we're going to have better sound, and just overall, it's going to look great.
And you're going to feel better, actually.
Right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you want to go to bobandbrad.com because we're always giving something away. Go to the giveaway section. We are giving away a Booyah Stick, a couple Booyah Stiks.
Yes.
There we go. They're great for shoulder pain and posture, and we got also stretches. Yeah.
Yes.
You can also find it on Bob and Brad on Facebook.
That's right.
And you can, if you want a short version of us, go to Twitter or Instagram. 60 seconds of Bob and Brad a day.
Very well put, Bob.
All right.
Could have swore you said that before somewhere along the line. All right. So TMJ, temporal mandibular joint. Everyone has TMJ if you have a jaw and you can talk. So actually,
that's not the problem. TMJ is not the problem.
Right. It's a disorder.
Syndrome.
TMD, technically, but that's just something we don't need to dwell on that. We can look at the skull though and find out why you have the pain. And just so you know, symptoms that you have, and you know if you haven't, some people have different symptoms.
Sure.
From pain, popping, clicking, headaches,
sure,
all part of this.
Especially headaches up in this area here.
Right. People that grind their teeth can, this can be associated with that. So this, I'm amazed at our other video, how many people over the last 3 years have commented, boy, this worked well.
Right.
Decreased the pain. We're going to add one more thing we forgot to add last time, and then we're going to start out with that is before you do these exercises, we're going to show you posture.
Right. And you wouldn't think posture would have anything to do with your joint, your jaw joint, but it does.
It has a lot to do, particularly head forward posture, which is extremely common, particularly in the last decade because of our use of the phones, computer use, sitting all the time.
I think always one thing to point out, Brad, is that try eating and swallowing with good posture, and then try eating and swallowing with forward head posture, and you'll find out you can't do it very well because of the position of your jaw and your throat.
Yep.
So
that's a fundamental of good jaw mechanics.
Right. So the big thing is, it is important that you work on your posture. Chin tucks are a great one to do. We've done these in many other videos. A chin tuck is basically tucking your chin like this and stretching the back of the neck.
Yep. Shoulders back too.
Shoulders back. And you're also not going down or up. You're just going straight back. You can do them throughout the day. Do them in the car. That's a great place to do them.
Usually 3 to 5 reps is good if you do them every couple hours. So
sure.
The next thing is avoid just chewing hard to chew things. What's going on if you look at the joint? Here's your jaw, and right here's the TMJ joint. Can you focus in on this a little bit, Mike, please?
I thought TMJ stood for the mouse jaw. Never mind. That's a little joke.
Why, Bob? That deserves a why, Bob. So, if everything's working smooth, the joint opens and closes very nicely. But what happens, usually one side of the jaw or the other gets misaligned, gets locked up for whatever reason, and then there'll be some clicking where the joint is not operating smoothly, if you will.
And quite often it can be the muscles around it.
Right.
They might be tight, or they might be sore.
Yep.
And so they're throwing off the mechanics of it.
Right. So that's exactly what this treatment is going to work on.
Right.
The two primary muscles, the masseter, the one right there. Oh my God.
My God, you lost another tooth. All right.
So that jaw, you ever see a horse? They got massive masseter muscles. It's that, joint, that muscle right there, or the mandibular right there. That's in that temple, the temporalis.
Temporalis,
yes. I'm sorry. I got all thrown off when
throw face this way, Brad, and point to the muscles.
Right there.
Right there, and masseter right there.
Let's put the head back on. I feel bad.
Nothing to lose your head over.
You're killing me, Bob. All right, let's get on with the simple massages. We're going to have to work around our mic system. That's the only disadvantage with this video with the new mic system.
Right.
We're going to work the mandibular muscle. Okay, Bob.
The masseter.
Masseter.
Yep.
Well, I'm really off.
Yeah, you're throw off now.
Yeah.
Okay, so we're gonna move up and down, right, Brad?
Yeah, actually, we're going to start moving up, just
Okay,
up.
just up.
Just up, and with the jaw gently closed. And you're going to do this, and you're going to use these 3 fingers and get those fingertips in there. Take your time with it. Think about your breathing. Relax your breathing.
And your posture. I want you to be in
Yeah.
good posture while you're doing this. You don't want to be head forward like this. That's why it's good to be in a chair even,
Yes.
and with a back support.
Precisely, Bob. Now, actually, this is a good one you can do right with us on this video. So just jump right in anytime. And after you do that, 5 to 10 repetitions, and you're going to go up to your, did you hear that, Mike? Is that making noise on the, oh, really?
Really?
I didn't shave this one, but don't tell anyone.
Yeah.
Up, the temporalis muscle. This is one, I don't have TMJ, and this feels fantastic one way or another. Work those muscles. And then the next one is simply the reverse. Instead of going the vertical strokes, we're going to go downward. And you can reverse it right on the temporalis muscle. Breathe in.
Yeah, breathe. And again, good posture.
Oh, yes. Nice.
Okay.
And then we'll go down on the masseter. What's the masseter muscle named after? Is that one of those Latin words for
I
something?
imagine.
Okay, next one. You're going to take, you can do this with your fingers or you can do it with your knuckles. Jaw still gently closed and work circles. You can go clockwise. You can go
Our mic's sounding bad. How about we just show on one side?
Yeah, one side. You can do both sides. And it's okay just to do one side at a time. You can kind of support your jaw with the other one. Yeah, and work those knuckles in there.
Work it both ways
Yeah.
and work deep down into the muscles.
The idea is you get those muscles that are tight to loosen up and allows the mechanics to go back where they should.
Working the way they should.
Exactly.
You're not going to have the imbalance.
Yeah. And you can again do that on the
temple
temporalis.
itself.
You bet. Now, the last one,
My
my glasses aren't working either with that, is do it with the jaw open. Be a little more careful when you open the jaw. Yeah, you do it, Job. I'll talk. So, and you can do the
up or down
or the circles.
Okay.
Just go through them all, and you're going to spend 10 to 15 seconds. What are you laughing at, Mike? Can you hear me? Okay. And then work it that way. Now we've got 2 other videos coming up with actual strengthening exercises that are also going to promote jaw mechanics with this. Mike, you got TMJ. We're going to work with him on this too, where he's talking about jaw pain. So those are coming up over the next few weeks too. So.
All right, we can't wait. Remember, we can fix just about anything
except for
a broken heart.
a broken heart is
But
right.
we're working on it.
and we won't stop.
Thanks for watching.